This video will explain how to use communication skills to better engage patients in conversations about their health. Engaging patients in conversations about their health is one of the main aims of behaviour change appointments. To do this, we need to build a friendly and supportive relationship, which can be achieved using a selection of communication skills. We know that the communication skills listed on page 9 of the manual are effective in supporting engagement. These skills are based on motivational interviewing techniques, so you might recognise them and may already be using some of them with your patients. The skills are providing general positive feedback, agreeing together what to focus on, active listening, asking open questions, helping the patient identify their own goals, giving patients time to answer, and using positive body language. Some of the symptoms of mental illness, such as anxiety, low motivation, or difficulty thinking clearly, can make it particularly difficult for these patients to manage their health. For this reason, these communication skills are especially useful for this group of patients. Positive feedback. Most of us can probably think of a time when we've received positive feedback and remember how encouraging it can be. Positive feedback can be very motivating because it demonstrates interest and recognises achievements. We can provide positive feedback to patients in a variety of ways throughout the appointment. For example, when greeting the patient, when you notice improvements in the patient's health measures, or when scheduling a follow-up. If the patient describes challenges that are common, you can also use positive feedback to affirm and normalise their experience. Agree what to focus on. Setting a joint agenda for the appointment demonstrates your interest in the patient's point of view. It also helps you to identify and focus on what's most important to the patient. You can start by asking the patient what their priorities are, then explaining your priorities, before agreeing together what you will focus on. Active listening. We're listening actively when we're focusing on understanding what the patient means when they're speaking to us. To do this, it's important to avoid getting distracted by your own thoughts, like focusing on what you want to say next. We should also try not to judge what's being said, jump ahead to something else, or make snap decisions about what should happen next. You can show the patient that you are really listening by reflecting back what you've heard. This reflection will also help you to check that you've understood the patient correctly and gives them a chance to explain further or correct any misunderstanding. Ask open questions. Open questions are questions that require more than a yes or no answer. They encourage engagement by giving the patient more freedom to talk. This can help you both to explore what's most important and what might be getting in the way of making any necessary changes. If you find it difficult at first to think of open questions, you could start by asking questions that begin with phrases like how or what, as these tend to be more open than questions beginning with phrases like did you or when. Be careful when asking questions beginning with the word why. These questions are usually open, but can sometimes come across as judgmental and unsympathetic. Help the patient identify their own goals. Telling people what to do isn't usually very effective, so it's important that goals are led by patients. However, they may need your support to identify goals that are relevant to their health. Instead of saying, "You should do this," help them identify their own goals by asking them about their priorities. If the patient hasn't identified a goal that's relevant to their health, support them with this by highlighting any important gaps in their goals. Give patients time to answer. Don't be afraid of silences. Some patients may take time to think about things. In fact, Giving patients time to answer can give them much needed space to work out what's important to them and what might be getting in the way. Silences can be more difficult if you're talking to the patient on the phone. In these cases, you may find it helpful to let the patient know you're giving them time to respond, or to give very brief acknowledgements when they're not speaking. Use positive body language. Using positive body language demonstrates to the patient that you're on their side. This means avoiding gestures that might be interpreted as defensive, aggressive, or uninterested. For example, folding your arms or finger pointing. You can display positive body language by using open and welcoming gestures or expressions. For example, smiling and looking at the client when they're talking. Providing information and advice is a key part of health professionals' roles, but it can sometimes be difficult to do this without disengaging the patient. A good way to keep the patient engaged at this stage is to make sure that you're only providing information or advice that the patient sees as relevant. If you're unsure what's relevant, try asking what they already know, then provide advice or information that fills any gaps. And finally, ask what they think about it and whether they need any more information. These communication skills don't need to be used in this order. You can use them at any stage of the appointment, and you may use some more than others, depending on the situation. On pages 10, 13, and 15 of the manual, you'll find flowcharts outlining what should happen during appointments. Most of the communication skills, such as active listening, asking open questions, giving the patient time to answer, and positive feedback and body language, should be used throughout the appointment. Skills such as agreeing what to focus on and helping the patient to identify goals might be most useful towards the beginning of the appointment.